Business Unity South Africa wants to know why President Ramaphosa is pushing ahead with the signing of the contentious National Health Insurance Bill despite concerns over it. The business lobby group and other stakeholders believe the bill is not ready to become law in its current form. Busa says the current bill will be damaging to the country's healthcare sector, to the economy more broadly, and to investor confidence.
As a country, we have X number or amount of resources that we have available. Here I'm talking about financial resources, I'm talking about human resources that are available to service our health needs. Now, you cannot ignore these resources and think that you can simply proceed to implement so major reform without taking these into account. What I mean by this is the fact that the health workers have indicated that they have concerns. And so, for the NHI to be fully implementable, you would need the full buy-in of the health workers and address whatever concerns they have.
Business Leadership South Africa warns that the move will be destructive for many stakeholders and relationships at a time when partnerships between government and business are critical to build confidence globally that South Africa is an investment destination. It says the law will never work simply because there's no capacity to implement it, and as soon as it is signed, it will be embroiled in litigation on several fronts, including on its constitutionality. Momentum Health Solutions says to create and implement a national health system, current constraints must be taken into consideration.
Unfortunately, our South African economy is a little bit suppressed. Unemployment is at its highest that it's been for a while. We don't have as much tax base in order to be able to fund new initiatives. And so as a result of that, anything that's going to cost our economy more money is a difficult thing to implement. We believe that the bill in its current format is likely to do that.
The Board of Healthcare Funders says it is unfortunate that the bill will be signed in its current form. The board says it is particularly concerned about Section 33 of the bill, which says that medical schemes will not be able to cover or pay for any health service offered by the NHI.
When we provided comment on the bill, we did not only touch on this issue, but we also addressed other issues which we feel will compromise the NHI fund in terms of actually meeting the objective that is set out. So it's not a surprise that you have many stakeholders who are quite uncomfortable with the bill just because it is quite far from what the stakeholders have given in terms of input and comment.
Despite growing criticism, KATU says this is a good way to equalize healthcare in the country.
We cannot sustain a society where 250 billion rand a year spent taking care of the medical needs through medical aid of 16% of the population. Even they can barely afford medical aid costs and premiums and out-of-pocket payments. And a similar amount is spent taking care of 84% of society who depend upon the state's overstretched and under-resourced public health infrastructure. As a result, many people are simply dying of diseases which could easily be identifiable, preventable, manageable, and even curable. This has an impact upon the families who lose loved ones, breadwinners. It has an impact upon the economy, which is disrupted when people pass away or are too sick to work. It has an impact upon the fiscus, which has to cater the bill.
The signing ceremony will take place at the Union Buildings in Pretoria at 2 p.m. on Wednesday. Diabo Seto, SABC News, Johannesburg.